and it is time to bring out our final finalist. That company is Carbon Health. Presenting for Carbon Health are Aaron Bali, Tom Berry, and Greg Burrell, MD.
Hello, TechCrunch. My name is Aaron Bali, and I'm the founder and CEO of Carbon Health. With me on stage are my co-founders, Tom Berry and Dr. Greg Burrell. As crazy as it may sound, we are building a healthcare system from scratch. Let me tell you why. 8 years ago, I moved from Turkey to Silicon Valley to start a company called Udemy. Today, Udemy is the world's largest marketplace for online courses. I was lucky to witness how a seemingly undisruptible market could be transformed with the power of networks. But a few years ago, something moved my attention from education to healthcare. My mom had a rare disease called neurosarcoidosis. And going from doctor to doctor with hundreds of pages of documents and desperately trying to tell her story, I started building a fresh perspective at healthcare. My mom recovered, which is great. But since that day, I have been imagining this system where all doctors, nurses, pharmacies, labs across the country can collaborate to give the best possible care to their patients. Almost like everybody is a part of one amazing hospital. Almost like the world's largest hospital. But obviously, that's crazy, right? There are a lot of things that make up a hospital. You just can't replicate them, right? Isn't that so? I'm not convinced. Let's take a look. At its core, there are doctors in hospitals. They give the actual care, and they are the heroes of the system. The hospital itself is mostly an administrative layer that handles things like registration, billing, and shared access to medical records. Turns out, you can replace most of these things with technology. And just like Udemy became the world's largest school, and Airbnb is the world's largest hotel network without owning any buildings, and Uber is the world's largest cab company without owning a single car, we believe that the world's largest hospital won't be about buildings. Instead, it will be a ubiquitous technology platform that connects us with our doctors. And that's exactly what we are doing at Carbon. I'll let my co-founder, Tom, show you guys the product.
So, onboarding with Carbon couldn't be easier. You just scan your insurance card, and we'll figure out your carrier and get all the details we need to know from them. Then you pick an emergency contact, pick a preferred primary care doctor, and sign your name on our privacy notice, and you're good to go. So could we switch to the live application? So once you've been using Carbon for a while, your home screen will look something like this. A snapshot of your health organized by the conditions that you have. Here you can see my chronic asthma and the wrist that I broke last month. You'll see everything here, your medical images, lab results, prescriptions, appointments at our clinic, and everything else right on your phone. But this is more than just a record. You can do more than just look. You can take action. Send those prescriptions to your house. Schedule reminders to take your pills. Interact with your CT scans. Learn what your lab results mean. Find a specialist and send them your referral. And we're just getting started. So when you click inside a case, you'll see the messaging history between you and your doctor about that condition. No need to make sure you're keeping track of everything they tell you. It's right here. And if you click on the Details button, you'll see the actual medical chart that your doctors are using to take care of you. We've painstakingly designed the doctor experience, too. So what happens at the moment that you need help? Just click the big blue button. You could quickly schedule a vaccination or a wellness checkup, but in this case, let's say it's a new issue. So we automate a lot of the questions your doctor would already be asking to save time. These questions will change dynamically based on your answers and your medical history. Soon, you're all finished, and one of our physicians has been notified to review your case. They'll usually ask some follow-up questions, and they might give you a treatment that you can take care of at home, or if they need a physical exam, they'll ask you to come into the clinic for an appointment. We've built a seamless hybrid between virtual and in-person care. So when you come into the clinic, your doctor has all of your virtual interactions as context. And when you leave, you and your doctor can elect to do follow-ups virtually. So after the appointment is over, you'll receive a treatment plan. It'll show up right in your messages, and it has everything you need to take care of. So in this case, we see some notes, a follow-up for next week, and some prescriptions. So let's go ahead and fill one of those prescriptions. You could elect to send it to a pharmacy for pickup, or get it delivered to your house. And because Carbon knows that this is an antibiotic that should be taken each day, say around bedtime, we can schedule pill reminders automatically, and all you need to do is flip them on. You want to finish up?
Sure.
Could we switch back to the presentation?
Yeah. OK. There are a lot of details, other details that we don't have time to show you guys on stage. But the important thing is, at Carbon, since we control your experience all the way from the application on your pocket to the iPad application that our physicians are using, and your visits and third-party integrations, we are able to design a user experience that would otherwise be impossible for traditional healthcare providers. We are launching Carbon this Monday in our San Francisco clinic. But soon, we will let all those independent practices across the country to use Carbon in their practices, and we will together make a connected healthcare system. Go to carbonhealth.com and join us. Let's design the future of healthcare together.
All right, great work, Carbon. Judges, who has questions? Susan.
Well, so these are all doctors that will work for Carbon, is that correct? Or do you have doctors out of network too, and then does it have to do you have to just start in one location, and how does that work?
OK, let me explain that. Good question. So we opened our first clinic in San Francisco. So the first clinic is a pilot primary care clinic in San Francisco, and these doctors are our salary doctors and nurses. So we are kind of nailing down the user experience in our own clinic. But we won't be opening any more clinics, right? The next thing is we will open our technology to other practices who want to use that. And then we'll go from there. And right now, we are focused at primary care. But at one point, we'll start adding specialists, and we'll let them join Carbon Network. And then we'll open Carbon to other cities.
How do you get, let's say I sign up with a doctor on the Carbon Network. How do they get access to hospitals? How do you extend beyond just symptoms that I can talk to you about?
Yeah, that's a good question. So because in healthcare, most clinics focus on a particular area. So we chose primary care for multiple reasons. First, it is the hub of most of your healthcare interactions. For most of the time, you want to go to your primary care doctor first, and then get referred to another specialist or maybe a hospital. And secondly, is that's a consumer decision. So usually, you don't choose your specialist. Usually, you choose your primary care doctor, and your primary care doctor refers you to other people. So the way we work with the specialists is, so currently we will just refer them patients to either a specialist in another clinic or a hospital, right? And although that person is not a part of our network, we will still do our best job handing you over to the next doctor. First of all, we let you choose the right specialist, right? So we have our physicians are creating lists of doctors in every area. Second is we are sharing your medical records in a HIPAA-compliant way with that doctor. Whether they use Carbon or not, they will actually receive them. So with the hospital, it's kind of similar to specialists. So instead of one specialist, we can actually refer you to any doctor in a hospital setting. But the only thing is when it's in a big hospital chain, it's not as easy for us to get the information back. So we'll still try to import it, but it's not going to be as seamless as if that doctor was also part of Carbon's network.
So have you tried to onboard any out-of-network doctors yet, or have you talked to them? And if so, what has the response been?
Yes. So we talked to them, certainly. So we'll start accepting them February of 2017. So for the next 6 months, we want to just really nail down the experience, patient experience, which is what we really excel at. So when we talk to them, most of our sales process, most of our pitch is very straightforward for them. We send them new patients, so they don't have to change their existing practice at all. The only thing that they have to do is accept patients that Carbon sends them. The commitment on their side is, first, there's a schedule integration, which is pretty straightforward. The other one is for the patients that we send them, so Carbon sends them, we want that doctor to use our iPad-based application to see them. So this will change the experience of the patients. First of all, they won't need to go like fill their registration form. They will just go there, enter the exam room. Everything the doctor wants to know about the patient is already there. If that patient talked to our virtual doctors and got some maybe quick medication, they're all right there. They don't have to do any digging. And the doctor sees that patient with our software and the patient leaves the room. So the doctor doesn't have to do anything else after the appointment. So the commitment on their side is just like learning a new tool. But I can promise you, we made by far the most intuitive software in healthcare world for doctors, right? So that overhead shouldn't be a big deal. But my experience with Udemy is, when we first launched Udemy, some people put their courses up there. But then they realized that like, it was so much easier for them to like, do their education business on a platform that they actually moved their existing students to our platform. That's how we grew a lot. I think similarly, a lot of doctors will realize how much easier it is to practice on Carbon's platform than what they currently do, which is a complete mess. So some of them may want to move their existing patients to Carbon. And that's going to be a migration process. It's not going to be that trivial, but we believe that's the value is worth it.
So with this clinic that you're opening in Soma, how big is it going to be? Like how many doctors, patients are you expecting to see?
Sure. Well, currently we have 3 doctors, and we're in the process of hiring additional nurse practitioners as well. And so we're planning to be able to grow as we accept new patients. And we'll have both, of course, the virtual and in-person practice. So we have the ability to kind of flex a bit as we expand to more virtual services. And we expect that a good chunk of our patients will be coming to us virtually and doing video medicine as well.
So that virtual process, so the bit that you showed there where they're like, hey, I have a boil on my forehead and I need this thing or whatever, and it shows a bunch of replies. Is that an automated bot process at the beginning, just to ask all the normal questions and they just tap, tap, tap to reply?
It is. And at the moment, it's essentially algorithm based on what your answers are. We give the patient an opportunity at the end to write additional things, and then it's reviewed by the doctor, but it's essentially cutting down on the time that each individual doctor has to spend on a case.
Yeah. That's based on like the basic diagnostic questions a doctor would ask before they really start getting into it.
Yeah. Actually, I want to just make some additional comments there. So, like, we have a contrarian point of view about this because pretty much everybody in Silicon Valley wants to disrupt doctors' decision making and make algorithms that are, like, at one point in the future they might be very useful. But I think a lot of the time the doctors are currently losing is not like the decision making. That decision making happens really quickly. A lot of them are asking the same question that everybody else has to ask, right? Typing up a treatment plan that was probably typed 100 times or like 10,000 times before. So we want to really cut down all those kind of like inefficiencies first. And eventually we might help doctors' decision making and maybe give some suggestions. But we are not making any automated medical decisions. Everything is controlled by doctors. We're just trying to reduce time that they waste in things that they really shouldn't.
So your system stores medical records?
Yes.
Okay. So your clinic, do you have any other computer systems in your clinic, or is it purely running on your software?
It's purely running on our software.
Yes.
So is your goal, in the end, to say an out-of-network doctor could just have your iPad in there, or an iPad with your system on it in their office, and that's all they need?
Yes, that's all you need. You don't need a billing company. You don't need an EHR, like a patient portal, or like there are all these other things that they're going to deal with. You don't need that. Like the experience is pretty much a patient comes, right? You probably have a front desk person that greets them. And when you're ready, you accept the patient. You see what they have, and then you make your medical judgment. You tell us what kind of prescriptions you want, what kind of medical images you want to request, and if you want to do a follow-up, even those are like all stored in the system. And the patient lives. You don't have to do anything else. And I can't emphasize how much of a problem this is for doctors. Like what they hate most is all this duplicate work they have to do, because in the current EHR, I mean, actually, I want to explain why we end up building our own EHR, right? It's because in current EHRs, the doctors have to just describe what happened in just plain text. The patient came with these symptoms, I gave these drugs, and I did that. And then usually there's like a duplicate work, somebody else looks at those notes, either the doctor himself or a medical assistant, they will have to do billing and try to guess.
All the transcription afterwards.
Yeah, exactly. But instead we collect the data in a very more structured way, right? This way that duplicate work is not necessary because as the doctor is filling out the chart, we also know exactly what billing codes we will be submitting, right? There's still like some back and forth that Carbon is going to take over. So if the insurance doesn't want to pay, we will be fighting them. But the system is mostly automated.
How do you make sure the doctor is actually forced to use your platform? So if they're seeing a patient, how do you prevent them from creating handwritten charts? They don't enter the data.
Yeah.
How do you maintain data integrity where I know all of the records are there?
Yeah, that's actually a great question. So in most marketplaces, that's a big problem, right? So we don't think we will have that problem for multiple reasons. First of all, we don't charge anything to the patient. So this whole concierge level experience is free for them. And we don't charge anything for the doctors either. We only charge a percentage of their total billing, right? And that the amount we charge is in line with what they pay to a billing company or a practice management software. So there's really no financial gain at like taking that patient like outside Carbon, right? You're not going to make any more money. You'll probably make less money because we can do things a little bit better than small practices, right? For example, like most of our payments are going through your credit card automatically, so we can reduce bad debt a lot, right? So there are a lot of other things that will reduce pain, like this, and there's almost pretty much zero value at like extracting that patient from Carbon.
Susie, did you have a question earlier?
Yeah, do you think this is going to be used mostly by small clinics? Like I can't imagine, or do you think Stanford Hospital, for example, at some point could be a client of your service? And if so, would it be an add-on for a big hospital? I mean, I can't imagine it being a replacement of all the like huge amount of infrastructure that they've put into place.
Yeah, that's another great question. So what we do is like we want to control the primary care experience, right? So, and eventually we'll open to specialist areas, but we are still only focused at outpatient care. So we are not interested in intensive care or like surgeries or inpatient. So that's what I think hospitals are really good at. And like they're not necessarily as good as like the outpatient stuff. That's what we want to unbundle from them. So our focus is small practices right now. So we want them to switch to our system. But specialists don't have to switch all their systems. For specialists, or even we will have the same thing for hospitals, we want to still handle scheduling. We still want to handle passing medical records in a HIPAA-compliant way to them so they don't have to do duplicates like work. I mean, you can talk about how maybe specialists, like right now it's like so hard for specialists to get your original records. They often redo all the lab tests or medical images just because that's easier than getting it from your previous doctor. So we want to handle all of those. And we will be importing your medical records back from them, which is one of the P's in HIPAA compliance is the portability, right? So we have that right. But the hospitals may not switch to our platform because they have a lot of other complexities that we wouldn't be handling. So there will be like essentially a slightly different form of integration for larger hospitals.
Okay, we're out of time. Give it up for Carbon Health.